So hello, my name is JV and I'm here to discuss to you preventing fetal exposure to teratogens. So, what are teratogens? So, a teratogen are any factor, physical or chemical that adversely affects the fertilized ovum, the embryo, or the fetus. Because a fetus is very or extremely vulnerable to environmental injury, especially on the beginning or the early weeks of pregnancy. So right now, I'm going to discuss the effects of teratogens to fetus. So, the strength of the teratogen is the first one. For example, radiation is a known teratogen. In small amounts, it causes no damage, but in bigger doses, it could cause fetal defects or death could occur. So the timing of the teratogenic insult is a second factor that makes a significant difference. If a teratogen is introduced before implantation, for example, a zygote is destroyed or it appears unaffected. A third factor determining the effects of a teratogen is the teratogen's affinity for specific body tissues. Lead and mercury, for example, attack and disable nervous tissues. Thalidomide or immunoperin that's been used in treating nausea for the pregnant people is now prescribed to the people that's been treating cancer. So this time I'm going to explain to you or discuss teratogenic maternal infections. So teratogenic bacterial infections involve viral, bacterial, or protozoan organisms which cross the placenta from mother to fetus. So most infections that may detract from a healthy pregnancy outcome causes relatively mild flu-like symptoms in the woman but can have much more serious effects in the fetus or the newborn. Preventing and predicting fetal injury from an infection is complicated because when a disease is subclinical, it is difficult to analyze and any effect on the fetus. So the first teratogenic maternal infections is malaria. Malaria in humans is caused by intraheterocytic protozoa of the genus Plasmodium transmitted to humans by the bite of an infected female Anopheles mosquito. Healthcare providers can contact it from infected blood products. During pregnancy, women can transmit malaria to a fetus. Most malaria infections in the United States occur among the people who have traveled to areas where malaria is epidemic, such as Africa or South America. A number of drugs such as chloroquine or Aralen is the first trimester and the mefloquine or Dolarium in the second or third trimesters are helpful. Women who will be visiting an area known to be epidemic for malaria can begin treatment as prophylaxis up to 2 weeks before travel. The second one is toxoplasmosis. Toxoplasmosis is a protozoan infection. It spread most commonly through contact with uncooked meat, although it may also be contracted through handling cat stool in soil or cat litter. As many as in 900 pregnancies may be affected by toxoplasmosis. Pre-pregnancy serum analysis can be done to identify women who have never had the disease and so are susceptible, or about 50% of women. Removing a cat from the home during pregnancy as a means of prevention is not necessary as long as the cat is healthy. However, taking in a new cat which could be infected is unwise. Instruct pregnant women to avoid undercooked meat and also not to change a cat litter box or garden in soil in an area where cats may defecate to avoid exposure to the disease. Also reinforce proper hand washing after handling uncooked meat. So the third one is the rubella or the German measles. The rubella virus usually causes only a mild rash and a mild systemic illness in a woman, but the teratogenic effect on a fetus can be devastating, such as hearing impairment, cognitive and motor challenges, cataracts, cardiac defects, thrombocytopenic purpura, and dental and facial clefts such as cleft lip and palate. Typically, a rubella titer from a pregnant woman to estimate whether a woman is susceptible to rubella is obtained on the first prenatal visit. A titer greater than 1/8 suggests immunity to the disease. A titer of less than 1/8 suggests a woman is susceptible to viral invasion. A titer that is greatly increased over a previous reading or is initially extremely high suggests a recent infection has occurred. A woman who is not immunized before pregnancy cannot be immunized during pregnancy because the vaccine contains a live virus that would have effects similar to those occurring with the subclinical case of rubella. After rubella immunization, a woman is advised not to become pregnant for about 3 months until the rubella virus is no longer active. Immediately after a pregnancy, assess whether a woman who has low rubella titer would like to be immunized to provide a protection against rubella in future pregnancies. An increasing concern is women who demonstrates antibodies against rubella yet still become reinfected during pregnancy. So the next one is herpes simplex virus or the genital herpes infection. It's a sexually transmitted infection spread by intimate contact. The first time a woman contracts an HSV infection, systemic involvement occurs. The virus spreads into the bloodstream and if a woman is pregnant can cross the placenta to a fetus, thus posing substantial fetal risk. Typically, HSV2 is the cause of genital outbreaks and caused by genital to genital contact. Increasingly, HSV1 can cause genital outbreaks and is often transmitted during oral sex. The management of genital herpes is the same whether HSV1 or HSV2 is the cause. If the infection takes place in the first trimester, severe congenital anomalies or spontaneous miscarriage can occur. If the infection invades during the second or the third trimester, there is a high incidence of premature birth, intrauterine growth restriction, neurologic disease, and continuing infection of the newborn at birth. Mortality may be as high as 60%. If a woman had oral HSV, typically HSV1, infections before contracting genital herpes, or if the genital outbreak is recurrent, antibodies to the virus in her system help reduce the severity of the outbreak and help prevent spread of the virus to the fetus across the placenta. If genital lesions are present at the time of birth, however, a fetus may contract the virus from the direct exposure during birth. For this reason, if a woman has existing genital lesions at the time of birth, cesarean birth is usually advised to reduce the risk of the route of infection. This awareness of the placental spread of HSV has increased the importance of obtaining information about exposure to HSV or any painful perineal or vaginal lesions that might indicate this infection at prenatal visits through conscientious history taking. The next virus or the infection is the cytomegalovirus. Cytomegalovirus or the CMV is a member of the HSV family. It's another teratogen that can cause extensive damage to a fetus while causing few symptoms in a woman. It is not sexually transmitted but spreads from person to person by droplet infections such as occurs with sneezing to person. If a woman acquires a primary CMV infection during pregnancy and the virus crosses the placenta, the infant may be born with severe neurologic challenges or with eye damage, hearing impairment, or chronic atrophy or chorioinitis, or liver disease. The newborn skin may be covered with large petechiae or blueberry muffin lesions. Because a woman has almost no symptoms, she may not even be aware she contracted an infection. So, teratogenic drugs. Many women assume the rule of being conscious or cautious with drugs during pregnancy applies only to prescription drugs and continue to take over-the-counter drugs or herbal supplements freely during pregnancy. Although not all drugs or herbal supplements cross the placenta, for example, heparin, does not because of its large molecular size. Always look for a drug-listed category before administering it to a pregnant woman, to be certain it will be safe to administer. In addition, two principles always govern drug intake during pregnancy. The first is, any drug or herbal supplement under certain circumstances may be detrimental to fetal welfare. Therefore, during pregnancy, women should not take any drug or supplement not specifically prescribed or approved by their obstetric provider. The second is, a woman of childbearing age should not take any drug other than one prescribed by obstetric provider to avoid exposure to a drug should she become pregnant. Herbs. So herbs are not regulated by the FDA in the same way as medication. Therefore, they are not rated with regard to their safety in pregnancy, even though most are safe. American ginseng used to improve general well-being has been associated with birth defects, and the St. John's wort, an herb taken as a mood enhancer, can interfere with the action of seizure control drugs such as phenytoin and phenobarbital, and so should be avoided by women prescribed such drugs. Next one is environmental teratogens. Teratogens such as impure air or water can be as damaging to a fetus as those that are directly or deliberately ingested. Women are exposed to this through contact at home or at work sites. Breathing air filled with pollutants, for example, has been shown to lead to a fetal growth restriction. Next one is the metal and chemical hazards. Particles and common monoxides such as from automobile exhaust should be avoided as these are examples of chemical teratogens. Arsenic or byproduct of copper and lead smelting is used in pesticides, paints, and leather processing. Formaldehyde used in paper manufacturing, and mercury used in the manufacture of electrical apparatuses and found in high proportions in swordfish and tuna. are all teratogens that can be found at work sites. Lead poisoning generally is considered a problem of young children who eat lead-based paint chips. But it can be a fetal hazard as well. Women may ingest lead by drinking water that travels through old pipes that are leaking lead by sniffing lead-based gasoline or eating paint chips. Lead ingestion during pregnancy may lead to a newborn who is both cognitively and neurologically challenged. So that is all for my topic in preventing fetal exposure to teratogens. Thank you. See ya!